When it comes to your health, it's far better to test than guess. If you've tried several things on your own or with other practitioners but never really gotten the traction or results that you're looking for, I would highly recommend that you consider some updated assessments. We regularly run screening blood work and are happy to review any tests that were completed by your other healthcare providers. But we take it a step further. I have this concept called the line of fine. Often blood work is being used to rule out disease. If you've ever heard that everything is normal and you're fine, but you don't feel great, you know exactly what I'm talking about. Functional testing is the perfect tool to help take you beyond that line of fine and towards feeling great. We utilize stool, urine, saliva, and breath testing, as well as some simple at-home tests to assess how your body is really functioning, not just to rule out disease. This helps give us a good baseline on you, to confirm our hunches, and can even save you time and money because we can get to the heart of the matter. We don't simply recommend all of the tests for every single patient, but rather we work with you to decide which ones will be able to provide us with the answers you need so that you can get better faster. Of course, we've got many tools to help you along the journey with or without testing. You are an active partner in your care, and I want to make sure that you have the right information to make the best decisions possible. We regularly recommend retesting to keep you on track. These tests are a wonderful opportunity to help you understand your body so that you can have the great health and focus on what matters most. Don't confuse fine with amazing. Let us help you get there.